Good afternoon and welcome to the meeting of the Governor's Interagency Advisory Council on Homelessness to Housing Technical Assistance Committee. This meeting has been publicly noticed in compliance with Nevada's open meeting law. Chair Michelle Fuller-Hallower will call the meeting to order.
Good afternoon. It is 1:03 on December 16th, 2025. I'd like to call the meeting of the Nevada Interagency Advisory Council on Homelessness to Housing Technical Assistance Committee to order. Abigail, would you please call roll?
Yes. Chair Michelle Fuller-Hallower.
Present.
Vice Chair Brooke Page.
Present.
Austin Pollard. Dr. Pamela Janelle. Chris Murphy. Adrienne Babbitt.
Present.
Julie King.
Present.
Dr. Diana Turner.
Present.
Dr. Katrina Grigsby Thedford. Arash Ghaffori.
Present.
Thank you. We have quorum, Ms. Chair.
Thank you so much. And thank you, committee members, for showing up today. We appreciate your commitment to the work that we need to do. I will start the agenda with agenda item number 2. This is our first of 2 public comments. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you're making a public comment via phone, please call 1-773-321-6111. The ID number is 489-058-294#. We are now open for public comment. Please unmute yourself and state your name for the council. Do you have any public comment? Anyone on the phones? Abigail, did anyone send in any email or written correspondence?
There is none.
Okay. With that, I will just remind everybody that there is a second public comment at the end of the meeting if something comes up that you want to share at the end of the meeting. With that, I will close public comment, and when we will move on to agenda item number 3 for possible action, a discussion and possible approval of the minutes from October 21st, 2025 of the Interagency Advisory Council on Homelessness to Housing Technical Assistance Committee meeting. Advisory council members, you should have your minutes should be attached to your appointment notice that was in your calendar. So if you need to review those minutes, that's where you can find them. If there are any corrections or edits that need to be made, we can take that information now. If someone is ready to make a motion for approval for those minutes, we will also entertain a motion.
We'll motion to approve the minutes from the last meeting. Mr. Arash
Thank you.
Ghaffori.
Thank you, Arash. We have a motion to approve the minutes. Do I have a second?
This is Julie King. For the record, I second that motion.
Thank you, Julie. We have a motion and a second for approval for the minutes for October 21st, 2025. All those in favor, please unmute yourself and indicate by saying aye.
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 All those opposed, please unmute yourself and indicate by saying nay. Any abstentions, please unmute yourself and indicate that you need to abstain. Motion carries. Closing agenda item number 3. Moving on to agenda item number 4. We have a presentation from the Division of Public and Behavioral Health on their Learning Collaborative on maternal child health, housing, and food security. And I believe we have Sarah Rogers and Vicki Ives here to give us a presentation. Is that correct?
Thank you, Chair. Yes, Vicki Ives for the record. We're both present.
All right. Thank you and welcome.
Oh, thank you so much. Again, Vicki Ives for the record. I serve as the Bureau Chief for Child, Family, and Community Wellness at the Division of Public and Behavioral Health and work with our WIC programs, our maternal child, adolescent health, immunizations, chronic disease programs, account for family planning and food security. And I'm joined by my colleague, Sarah Rogers. If you'd like to introduce yourself, Sarah.
Sure. Thank you, Vicki. Sarah Rogers for the record. I am the Nutrition Unit Deputy Bureau Chief under Vicki with the Bureau Child and Family Wellness. And I am primarily responsible for overseeing our Women, Infants, and Children program, as well as chronic disease prevention and health promotion section, which encompasses our Office of Food Security.
Thank you. We really appreciate everyone's time today on this, but we are, along with a team of folks, are actively involved in a technical assistance opportunity for a learning collaborative, working with AMCHIP, which supports, it's an association supporting maternal and child health programs nationwide. And it's a maternal child health policy learning collaborative that's focused on really centering key populations of the Title V Maternal Child Health Block Grant in housing and food security efforts. And we're fairly early days in this learning collaborative, and we were just hoping to present some information about the goals of our efforts and see if any partners in either the housing space in particular or food security would be interested in joining. And really, the intent is to bring together cross-sector partners to identify actionable policies to improve housing and food security. And the populations of focus for this particular opportunity really center on women of childbearing age, families of children and youth with special health care needs, pregnant persons, and then children and youth with special health care needs themselves. So maybe foster youth who are aging out of certain supports into a difficult housing environment. So those were some of the populations, and really looking at, are there potential pathways and opportunities to prioritize some of these populations. And Sarah kindly shared this overview of just the structure of the learning collaborative, and can highlight some things on that in a moment. Just a little background: current partners include some of the of our food bank partners, some folks such as Children's Cabinet that might have a touch point on certain housing activities. But through the course of this 15 months, with some supported technical assistance and national expertise, really the goal is to come out of it with some policies centered around supporting these populations. Sarah, if you don't mind walking through just the structure of the collaborative, but our ask really today is, if it's of interest, we'd love to have your expertise, and to the extent that you'd like, whether it's in the monthly meetings or a less frequent touch point, to better understand the landscape ourselves, and if there's opportunities to implement some of the policy pieces identified. But Sarah, I'll turn it over to you here.
Yeah, I'm Sarah Rogers for the record. So as Vicki mentioned, we already are working with a group of people that we've recruited really in our exploration and partner recruitment phase. We're still actively in the partner recruitment phase and going into that collaboration and alignment. So we are working right now with 3 Square Food Bank Northern Nevada, Catholic Charities of Northern Nevada, and we have a couple other food security partners, and then as well as partners from the state Title V program. But one thing that we're really lacking is that voice and partnership from the experts in housing. We have a lot of great people who work in the organizations that are familiar with some housing initiatives and things. But our goal right now is to actively recruit some more of those housing subject matter experts who could help us really align some policy initiatives or looking at aligning any improvements or outcomes associated with how housing disparity specifically within that MCH population. And I will say, sorry,
Thank
Sarah
you.
Rogers, again, I will say that we are meeting with our team internally right now once a month. There's also an additional TA meeting once a month with AmChip, our federal partner on this. That is really within our internal team. That TA meeting is kind of just to attend if you want or as you can, but we're prioritizing getting the core group together at least monthly right now.
Well, thank you, Sarah. Vicky, I was for the record. And, you know, when we initially applied to be one of the 6 states chosen for this opportunity, we had quite a bit of focused ideas and in lieu of supports, social determinants of health type levers, and the impacts you know, that are happening with Medicaid are potentially less likely. So really focusing on those population groups and affordable housing and access, adequate and affordable housing and access to you know, the nutritious foods as well, and how to intentionally prioritize those groups to, you know, improve long-term outcomes with people's health is really the focus. So we just appreciate it if anyone is interested in participating. We'd be grateful, or in learning more. I'll put we could put our emails in the chat if anyone's interested in connecting or if there are any questions. But we really appreciate the opportunity just to share this learning collaborative and see if anyone would like to engage. Thank you. We really appreciate the work you all do and love to learn more about it.
Thank you. Are there any questions or comments from the group?
This is Adrienne. Vicky, I know you mentioned you had some partners in Northern Nevada in housing. Do you have any representation of housing partners in Southern Nevada?
On the foods side of things, we do in Southern Nevada, but I don't believe we do on the housing side at all. Correct me if I'm incorrect, Sarah, but I believe it's Northern focused on our housing partners currently.
Okay.
This is Michelle Fuller-Hallauer for the record. And what about in the rurals? Do you have any partners in the rural parts of the state?
Children's Cabinet does have some relationships with some rurals, but we could utilize a stronger footprint with the rurals as well as with Southern Nevada. So thank you for highlighting that.
And
I'd
have
say
you
the
done,
partial.
and a follow-up question to that, have you done presentations to the 3 continuums of care across the state?
One, but it's been a bit of time since that happened, but no, not to all 3. So thank you. That would be a great idea.
And do you know who to contact to get on those agendas?
We'd appreciate, if you don't mind sharing, that would be lovely. Thank you. Vicki, as for the record, sorry.
Yeah, you would contact rncoc at wingedwolf.org for the rural Nevada COC.
Thank you.
My team at Winged Wolf Innovations oversees the coordination for the rural Nevada COC, so that somebody on our team would help you with that. And then for Southern Nevada, the Help Hope Home, that team will help you with that, and that would be somebody out of Clark County Social Service can help you get on the agenda for that. I don't know exactly who is doing the specific coordination. My speculation is it's probably Carla, but I know that they have, you can email through Help Hope Home through the website and connect with somebody there. Or Arash is on the call here, and he could probably get you connected. And then Katrina Peters is with Northern Nevada COC. And if you need her email, you can, when you send the email to the RNCOC, just ask for her contact, and we'll send you her contact.
Vicki, as for the record, thank you, Chair. I appreciate it very much. Thank you.
Other comments, feedback, suggestions, questions?
Hi, this is Evelyn. I do have a question. I wanted to know if there would would you still be providing your emails in the chat for us to contact you later?
The chat is not
Most
an open
definitely.
chat because this is because of the state regulations around our open meeting law. But we can make sure that we get their email addresses, and we can put those in the minutes.
Thank you so much.
So if you could, I believe that someone from the Homelessness to Home had email contact with you to set you up. If you could make sure that they get your email, and we'll make sure that we get that included.
Thank you. Will do.
Thank you. Anybody else? Sarah and Vicki, thank you so much. If there are other things that we can specifically do for you, if there are the things that you identify that we can be helpful, or if you want to come back and give us, updates as your learning collaborative progresses, please take this as an open invitation. I think that it's great that you've got you're doing this work and bringing people together and helping our pregnant parenting folks in our community. So good luck, and please, if there are things that we can do to assist, let us know.
Deepest thanks for the opportunity. Thank you all.
Thank you.
Thank you.
Okay, so moving on to the next agenda item number 5, review of the legislative context of the Nevada Interagency Council on Homelessness to Housing. I believe at our last meeting, we had some conversation about what was actually in state legislation around the ICHH. And Dr. Turner said that she would do some research, and I believe that she has. Dr. Turner, are you able to give us kind of report back on what you found?
Yes. So I sent an email. I think Abigail also sent it out to the team. Let me try to pull that up really quick. Sorry.
It looks like somebody has pulled something up on the screen for you.
Oh, it's down. That's why I can't see. Okay, here we go. Sorry about that. So yeah, I did some preliminary research about our discussion that we had, just to kind of make the connection between the establishment of the committee itself that then fueled the creation of the Technical Assistance Committee. So the information that you see on the screen here talks about our about our law here that established the committee or the council, I'm sorry. And so C there talks about the establishment of the Technical Assistance Committee. And so we are to provide advice, information to assist the council in developing the strategic plan. And we may include without limitation representatives of federal, state, local, so a plethora of us that are on the call. There wasn't a lot of information outside of the NRS that's available. If you scroll down a little bit though, there were some links in this document, I believe. Okay. Where it was just some information that was freely just found on the internet that kind of referenced the committee itself, but there was really no other information in regards to the work of the committee in the past or anything like that. So if you guys have time to take a look at some of the links that are there, some information that was presented on the topic. And that's pretty straightforward, but that's what I was able to obtain online through searching.
Thank you, Dr. Turner.
Mm-hmm.
Any questions or comments?
Yes, this is Diana Turner for the record. Sorry. And I'll come on camera too. Sorry, guys. Kind of like working in between as well. Okay. So one thing that I recall that our purpose for even doing this, I think we wanted to make sure we had the clear understanding of our role in comparison to the council's role and making sure that we were kind of in alignment on the same page. Excuse me. A question that I had though is that I believe from our last call, we were discussing the time of their meetings compared to our meetings to see if I can't remember that part. So if someone can update me on that, were we trying to see if we were going to join or if we were just going to try to align it so we can start sharing out and kind of creating that bridge? Was that kind of the idea? I'm not sure. Sorry.
Oh, I think if I remember correctly, I think we had some discussion about whether we needed to shift our meetings or try to coordinate our meetings so that we were having meetings such that we were able to have a deliverables or report out ready to give to the council itself.
I think so.
But I don't, that was 2 months ago. I don't remember for sure.
I don't either. Okay. I was just trying to remember. I know our discussion around finding the history of, what created this and its purpose. So we can try to make sure we have that in alignment and then just make sure we're just not meeting to meet in a sense. So, okay.
Well, we do have the minutes. We could go back to the minutes from the last meeting and see what they say.
That's true. I will take a look, but it's correct.
This is Brooke for the record. I also think that this is really helpful. Thank you so much, Dr. Turner, for developing and compiling the information, because I think the intent was also to figure out what is the purpose of our work and did the legislation and the hearings provide some context as to why this group needed to be in operation. It's kind of more codified in statute. There's the ability to have other working groups, but this one has kind of kept moving and has a lot more activity and like just to make sure we're doing in alignment with the intent of the bill. So I appreciate seeing this.
I'm sorry for the silence. I was looking at the minutes. I'm on page 12. Arash, your hand is up.
Yeah, so I was just making sure that I didn't lose audio. Sorry.
Oh, no, you're fine. Yeah, it looks like on pages 12, 13, 14 is where we were discussing the ICHH and our meetings.
Okay.
To understand the intent of the bill and the legislation, the various working groups, what their reasoning and purpose was, bring back the historical context. Okay. Any folks reading? Is that? I just want to be mindful of. Is there any other discussion around this or anything else that folks wanted to bring up around this topic?
Hi, this is Adrian. I know that after the October meeting, the ICHH met and discussed it was for information only, so there was no action. But I think there were some thoughts tossed around about the direction that this group should take. I don't know if that's going to be an action item on the next agenda for them, but I thought that potentially gave some insight into their thoughts. Was anybody else at that particular meeting?
This is Chris Murphy for the record. From what I remember is that we requested that we were going to go back to the council to determine what else they would like us to do. And I know that I attended the last council meeting that they didn't have a board, so the meeting wasn't held. That's the best of my recollection.
Abigail?
Yes, Michelle, I was just going to confirm that yes, the council scheduled their meeting last December 5th, but they didn't meet quorum. They had it on their agenda to discuss and possibly vote to adopt the strategic plan. Also, it was recommended by our DAG for the Technical Assistance Committee to vote on a finalized strategic plan before the council can vote to adopt it.
Yes, thank you, Abigail. And yes, I was going to bring this up during agenda item number 9, but I'll bring it up now and then we can discuss it further under agenda item number 9. I did have a phone conversation with Chairman Rob, and he did say that he would like us to revisit our strategic plan, the action plan, and make sure that we as a technical assistance committee are good with the plan, that it is a tight plan, that everything is updated and current, given all of the things that are happening at the national and state stage, and then for us to vote to accept the plan and move it forward to the ICHH for approval, and then they will put it on their agenda to vote to approve the plan and the action plan. So I did ask for him to send that to me in an email or in writing some way. I have not received it in writing, but I did have that phone conversation with him. So, all right. Any more conversation around the legislative context of the ICHH? Okay. Not seeing any, then I will go ahead and close this agenda item and we will move on. Thank you, Dr. Turner. Appreciate your research and reporting back to us on this information. I think it helps to clarify, what is in legislation. So thank you for that. Agenda item number 6, this is for possible action, discussion and possible vote around the makeup of our Interagency Council on Homelessness to Housing Technical Assistance Committee and the definition of the scoring criteria for hiring or bringing on a new member. So as you know, over the last few meetings, we've been talking about what does our scoring criteria matrix look like? How do we define what that matrix is? How do we more clearly delineate what the scoring criteria is? And so we have had some conversations around that, and then we sent out the information out for folks to respond and send that back. And then we were going to finalize that during today's meeting. Once you all had an opportunity to kind of noodle that around, get that down in writing and send that back to Abigail to compile the information. So I believe what Abigail is doing is bringing the information up for us to review. So how many we've got 4 pages of information for review. Is that correct, Abigail?
That is correct. That's what we received so far.
Okay, so I think probably the best way to do, I'm not sure, I haven't seen this before, so I'm just kind of winging this as we get ready to go through this discussion. So if anybody has a better way or better thoughts on how to navigate or facilitate this discussion, I am absolutely open to handing off the reins and letting someone else kind of drive the ship as we move forward for this discussion. So don't feel like if you want to take charge and run this portion of the meeting, feel free to step in and do so. So as I'm just kind of perusing real quickly, it looks like we all kind of did things a little bit differently. So I'm wondering if it makes sense to take these one item at a time and kind of just think through what each item might look like and define that. I'm open to suggestions. Adrian.
Michelle, this is Adrian. People may love or hate this idea, but as a starting point, can we like run this through Copilot or something that says like summarize similarities and differences, just so that we can sort of have a artificial
Great idea.
executive summary?
Great idea. Can someone on our H2H team do that?
Where's the raise hand emoji?
Katrina?
Hi, everyone. I'm not sure if I completed this exercise or not, so if not, my apologies. I just have a comment. So when I think about lived experience piece, even though we're working to summarize all of this, I feel like that should be an additional point. It shouldn't be one of the main factors that score, because it'll throw it off if a person has experience in homeless services, experience in mental health and all this other stuff and development, but no lived experience. And it's almost like their score would be decreased because they don't have that. So if there's a way that can be like an extra point or couple or whatever, I think that would be amazing, just so it can be fair for the general public.
We can do whatever we want. It's our scoring matrix. So collectively.
Madam Chair, this is Arash. I kind of want to piggyback off what Katrina was saying, that I found it a little difficult with lived experience. I think it's more like binary, not degrees necessarily. You know, like either you have it or don't. But if you do, how are we going to decide on a Likert scale between 2 to 5 of more lived experience or something like that, right? So I think it may open us up to just in an easier way, just looking at the scoring and maybe make some things binary or not. And another suggestion I just have is um, this is this is the homelessness committee, right? And this work intersects with mental health and substance abuse and housing and many other coalitions and sectors. Is there a way to decouple those where one is experience within the sector, right? Homelessness, and then having stakeholder experience or I don't know how we couch the wording for mental health, substance abuse, but intersectional, something there, and having that be a separate score, because it's also hard to, like, if we're considering someone from the housing authority, okay, well, are we talking about their experience within the homelessness services, or the fact that their housing authority experience can bring value to the homelessness discussion? But that's all one score right now. So my two suggestions would be to make lived experience more binary, but in a way that doesn't punish people if you don't, but gives people an advantage if you do. And also maybe decoupling experience in homeless service, which is our core, versus other intersectional experiences that might be relevant besides lived experience. Does that make any sense?
Absolutely. What do other folks think about that? Adrian?
The only comment I have is that lived experience can be extremely personal. and to have to sort of display it in such a public manner where it's available publicly, we advertise it and put it in the letters, like to, if somebody chose not to share or disclose, you know, potentially traumatic or vulnerable point in their life, as you know, to get bonus points to serve, I don't necessarily think that they should be penalized for that either.
Go ahead, Arash.
I was just to say, my with the lived experience comment, I was just trying to simply say that to Michelle's point, we shouldn't punish someone, or I mean, sorry, to Katrina's point, we shouldn't necessarily punish somebody if they don't have lived experience, but there should be extra awarding for someone lived experience because that's a valued, a voice at the table. My comment is that I believe it should be, and I don't know what Katrina or others thinks, but I don't think there should be really a fluidity once we determine they have lived experience. Either they have it or they don't, to get into the subjectivity of saying, well, they only were kind of, living in their cars versus addicted to or whatever. I think it should be more binary. If they don't have lived experience, they don't. If they do, they do, and they get a point for it. That's my sense, my 2 cents, is just to make it either you have it or you don't, and we value it, therefore we score it this way, but not to make it subjective or we have to go in there and go, because I emailed the staff of the committee to ask them, is a Likert scale 1 to 5, and then it's actually 0 to 5. So 0 to me is no lived experience, but then 1 to 5 is what? The amount of lived experience you have, and I don't think we need to be that subjective.
Point taken. Other thoughts or ideas?
Michelle, if I may.
Yes.
The one that you're seeing on the screen is the summary we got from Copilot. We put in all the information that we received.
Can you scroll down?
I'm sorry, we have to close it and open it again. Just 1 second, Michelle, please.
Abigail, this is Adrienne. Did Copilot give you any areas of difference of opinion that might need to be fleshed out from individual contributions, or did it just incorporate everybody's suggestions into this document?
Yes, it just incorporated everybody's suggestions. We can try another way. Let me see.
The way this is currently laid out, it's very different than what we currently have as our rubric. What do people think about that?
This is Adrienne. I think that the current rubric could be a little more robust. I don't know that we need this much, though. I think we could pare this down to where we find the most value or the most strategic areas to score new applicants.
Can I just ask a group an open-ended question, Madam Chair?
Sure.
Yeah, so the intent of this scoring is to ensure that we have the most viable candidates, right? For this committee. So I guess without the scoring matrix in place or any of that information in place, my question to the group is what are the things that we value the most? And it looks like from that we're looking at lived experience, we're looking at experience within a relevant sector, and we're looking at this own person's experience. So okay, you have a homeless youth working agency person who has lived experience but has been on a job for 2 months. How do we kind of measure that versus someone who doesn't have lived experience but has been on a job for 10, 15 years, something like that? So I guess with each one of these categories, we want to look and see how much subjectivity do we want? Like, should we just say 1 means little experience, 2 means some experience, means 3 means maximal experience, and just make it 1 to 3 or 0 to 3? Either they don't have it, they have low level, medium level, or high level. And for each one of those that we think need those liker type of things, we do. And then for lived experience, we can add a point if and only received if you have it. And if we keep the numbers low, like if the Likert scale goes up to 6 or 7, it becomes more nuanced and it diminishes the weight of lived experience. So my suggestion would be to change the Likert scale maybe to be from 1 to 3 where it's appropriate. So a point for lived experience can actually have significance regardless of how else they're scored. And if we can ourselves as a group decide what each of those numbers sort of mean, then we're not being subjective and going, I think they're 3, I think they're 4. What does that mean? So if we just pick 1 through 3, then that can be low, medium, high. I'm not sure what. I'm just throwing out some ideas of how we can kind of I guess, further the conversation in terms of one, deciding which are the areas that we find the most value, and then two, going through the numerical exercise, because if we have 3 categories that can score up to max of 3 and then 1 point for lived experience, then we have simple, clean numbers. Like 10 is the maximum someone can get. Without lived experience, the maximum someone could possibly get is 9. And then we are looking for candidates that are scoring at least 5 or above or something like that. I don't know. But if we can make those decisions or have those discussions, and we can be talking more the same language with each other. And I've learned over the years to simplify things as opposed to complicate them. So I don't know if that has any value, and I don't think I asked a question actually, but that's what I think.
Yeah, I don't think you asked a question. I think you proposed a potential solution. So I appreciate you bringing that forward. What are folks' thoughts about that? Or potential revisions to what Arash is thinking or proposing?
This is Brooke for the record. I appreciate the framing that Arash gave, and I think to Adrian's point, like it's a simplified process that allows for folks that are volunteering to be on this committee to support ongoing recruitment, to Arash's point, identifying what is the key important characteristics, and if we can couple that with a very simple Likert scale that, but I think also whatever tool we're putting out for recruitment needs to be clear about that scoring criteria so folks can speak to those experiences in there if it's just a letter that they're providing. So that way folks understand how they're being scored. But I think identifying those values and what's important is, I think, an important exercise.
Abigail or Gregory, what are we looking at now?
Yeah, this is Gregory. This is the summary that Copilot generated for us, and what I have displayed right now are the supplemental application questions that were generated for us by Copilot.
So if we were to, I think there's value in some of these questions, so we don't want to lose what you have here, Gregory. I also want to go back and revisit what people have submitted during their homework for definitions for these areas. I also don't want to lose sight of some of the conversation we've already had, which is the suggestion of lived experience kind of being peeled apart from overarching scoring, and that kind of just being, an extra for lack of other terms. And I also would like to hear what the rest of the group has to say around. I think it was Arash that brought up the suggestion of kind of separating the homeless services experience from mental health, substance abuse, and justice involvement or other systems involvement, and kind of separating that homeless services experience from other ancillary intersectional experiences. So I think there's a lot going on here and a lot of things that probably need to be kind of taken in pieces for us to move this forward. And yet I think we need to kind of move things forward, because I don't think this needs to be belabored for hours upon end. I think that this probably can be a fairly quick conversation that we can come to a consensus around. I don't think this needs to take forever to do. So with that, what are your thoughts around separating out homeless services from other intersectional or ancillary type services? Let's start with that question. Separating those into two questions: experience in homeless services and experience in mental health, substance use, justice, or other.
Michelle, this is Adrian. Are you saying they would be two separate scoring categories, or it would be like one or the other?
I don't know that I am necessarily saying either one. I'm asking, and
Okay.
Arash, I'm going to kind of lean into kind of what you were proposing. I'm asking to the group what thoughts are. I think what I was hearing is the kind of the separation of it's two questions. Do you have experience in homeless services? If so, tell us what it is. Do you have experience in mental health service provision, substance abuse service provision, juvenile or justice involvement, or other intersectional service provision? So you could get points for homeless services, points for other systems that intersect with the homeless services system. Arash.
It more sounds like we have it sounds like we have the criteria of professional direct experience. We have the criteria of stakeholder relevance or experience. For example, someone like BitFocus, they're not necessarily a service provider, but they're critically important, right? So they're in that intersectional. And then the last two are lived experience, and then this own person's technical knowledge. So it seems like we have four groupings. One, direct experience in the homelessness sector. Two, some sort of stakeholder relevance or something valuable to the group in relation to homelessness. Two, three, lived experience. Four, their own technical abilities or their own experience. So those are the four. Yes, to answer the question, that is, I'm proposing to decouple your experience within the homelessness space and any other experience that might be relevant, whether it's an intersectional service experience, intersectional stakeholder data folks, national partners, local partners that may have relevance. That can all be in one other category. And then it seems like the last category is their own skills and knowledge relevant to their professional experience is what I believe that's getting at. So for me, it could be as simple as that for every category except lived experience, you make it 0 through 3. 0 meaning none, 1 being 25% of the mark, 2, whatever we want to do, something easy. And if we have 3 areas where we can score up to 3, and then the last area is lived experience, and that's binary, either you have it or you don't, then we can cleanly arrive at a number like 10 and just have 4 categories overall. Maybe I'm oversimplifying it or overcomplicating it. I'm not sure. But it just seems like the group doesn't want to add more categories. So if we don't want to necessarily add too many more categories or get too sophisticated into the scoring, that could be some easy ways where we could develop the categories, put some bullets of what we mean by that underneath it, and say the scoring is 0 through whatever, with 0 meaning nothing, 1 meaning a certain amount, 2 meaning a certain amount, 3 being the maximal amount. So we can all kind of judge equally with weight. So I can't scroll through the thing, but yeah. So there's a written component, but then we're scoring based on what they provide to us. So for me, I would propose having homeless's experience being the first one, um, uh, related experience, stakeholder experience, intersectional being the second, third being the skills and knowledge, and 4 being lived experience. And then whatever we put under the bullets for each of those, we explain how we score it. The first 3 will be scored from 0 to 3. I'm just making this up now. 0 meaning no, 3 meaning maximum. And then 1 for the lived experience or not. And then they can write according to that and we can score according to that. Just an idea.
Yeah, I think that one of the things that is kind of left off in the discussion that you're having, and I don't know if it's necessary anymore, it may or may not be, is that state geographic representation, right? Because this is the statewide interagency council or technical assistance for the Interagency Council on Homelessness to Housing. And part of the reason, and I don't know who all was here when we talked about this, But part of the reason that was included in the scoring matrix originally is because we had probably 90% of the people that were on the technical assistance committee originally were from Washoe County. So it was very deliberate in that we were trying to get more people from Southern Nevada and from rural representation. So just to ensure that there was more diverse representation on this group. Now, that might not be the case that we are so worried about at this point. Maybe we're worried about other things or other representation on this group. So, that's for us as a group to determine what are the things that we want to have on this technical assistance committee as we're reviewing applications for the makeup of the group. Do we want to lean more into skills and knowledge of the folks that we're bringing on that we need to get the work done, right? Is that more important? Is the work history or volunteer history and experience more important that's being brought to the table? Those are things that we need to determine. What is most important for the makeup of this group? And then that's the categories, right? Those are the things that we need to determine. If we're good with these, let's move forward. But I need your feedback. I need you to know what you feel. The silence isn't helping. So we need to move this forward. Give me your feedback so we can move forward.
For the record, I'm not providing feedback because I just completed my letter of interest to join the committee. So I'm just listening at this
Well,
moment.
then that's a good reason because you're not on the committee yet, so you can't give feedback yet. But the rest of the council
Right. I was
members
like,
who
I'm
are on
sorry.
the committee can.
I think, Madam
So,
Chair, people are tired of my voice. Go ahead, Katrina, please.
so I'm sorry, I was kind of in and out. People kept going in and out of my office, so I think I missed a lot of context. But I did hear the last part of whether we should kind of hone into skills and knowledge. I think experience in homeless services and all that, as well as skills and knowledge, expertise, are more important than geographic representation. It needs to be some representation in the state, but not statewide, right? And I think we need to just make sure that lived experience piece is kind of like a supplement corner too. But I don't know if if it makes sense to, because when I see state geographic representation, I'm thinking the whole state, right? Is asking what part of the state that you represent. But of course, they should be in Nevada. And then again, skills and knowledge and their experience in homeless services, mental health and substance use and justice involvement is important, in my opinion.
Okay.
And in the thing, so one last thing. So in the new application, and when people submit their documents, are we asking like why do they want to do this work? Is there anything in their own words? I just don't remember exactly. If we're just looking, is it something like in their own words why doing this work on this level is important to them?
It's a great question. Quite honestly, I don't remember what's in the request for letters. But that is something that we can absolutely revisit.
Madam Chair, this is Brooke for the record. Am I able to maybe make a recommendation
Yes.
for the interest of this agenda item topic? I think it might be worth maybe having like a small work group to flesh through this content that was shared, and in light of this discussion, and maybe providing a revised scoring rubric for a possible agenda item for a future meeting in order for us to like deliberate just based on the discussion. So that way we can have the work group think through the needs and sort of maybe make a recommendation.
Sure. How do folks feel about that?
This is Dayana Turner for the record. I would agree that having a subcommittee or ad hoc or something to flesh this out would be ideal, because there are a lot of, in the initial responses, we have a lot of varying information. And then I think for me, even though Copilot is great, I think this just probably added another layer that we didn't need. It's a good idea, but I think being able to probably manually kind of go through some of those responses and kind of synthesize that way may be a good idea. I think maybe also for a note, some of the definitions, going back to finalizing the definitions first. I think that was a part of that too. If I'm mistaken, please forgive me. Finalizing some of the definitions first, a part of that work group as well, or that committee or whatever's going to be formed, and then letting that translate into the criteria for membership. So maybe possibly doing both of those items a part of that, if that's possible.
I like that. And if I could add, if that group could also revisit the letter that goes out for recruitment once we have the new finalized definitions and criteria, to make sure that the letter is in alignment.
This is Katrina, for the record. I agree with the idea of having a subgroup go through and flesh everything out.
Okay. So it sounds to me like we've got a suggestion for, rather than voting on the makeup of the ICHHTA and the definition of the scoring criteria at this point, that we create an ad hoc committee to take on that task and then bring that back. I believe that's what I heard, and that they will finalize definitions, create the criteria, and potentially revisit the letter that goes out for the two potential members that submit their letter with the directions for the letter. Is that correct? Thumbs up if I summarize that correctly.
Sound correct to me.
Yes, correct.
Okay. Awesome. Do we have anybody who wants to volunteer to be on that ad hoc committee?
This is Katrina. I can be on it. Kind of depends on when we'll be meeting, or we'll have the option to kind of choose what's most available for us.
Okay, Katrina.
Before I volunteer for anything, just question, are we talking about creating a subcommittee of this committee to address this discussion we're having on the scoring matrix?
Yes.
Okay.
And it may just be a meeting or two. We just want to,
Yep.
in the interest of time and other agenda items.
Yeah.
Right.
Katrina, if you and I want to sit down and talk about it and present something to the group, I think that we could, to your point, knock this out in a meeting or two.
Yeah, I'm with it.
All right, that's fine. I'll work with Dr. Katrina on something like that. Get a little information on when things would be expected back by, et cetera. That'd be nice.
Okay. I know we've got 2 holidays coming up between now and our next meeting. Our next meeting, I think, is scheduled for, well, it would be scheduled for January 20th. Do you think that is doable for you all to get back to us, or would you need more time?
And I don't want to speak for Katrina because she volunteered for this first, but if the idea would be to come back to you guys with a draft of the criteria, some bullets underneath about what defines that criteria and the suggested Likert or other scoring that we use for it. If that's the case, so you guys can kind of review it a little bit. Katrina, what do you think?
I think yes.
Yeah, I think so too. So Katrina and I can work offline to get some meetings scheduled in early January and get something to bring to a group by the 20th. That should be okay.
Okay, great. So,
Also, sorry.
no, go
Really
ahead.
quick, can someone send us, I remember filling out the application, but if somebody can send us the blank one, so we can see what all they're asking in that, so we can also have that as we're going through everything, that'd be great.
Yes, and Abigail, if you could also send Arash and Katrina the answers that everybody sent in with their potential, how they defined the existing rubric, and even what you guys did up with the co-pilot, anything that we have around this, and send them currently the letter that you all send out. Send them all that stuff so that they have everything to work with, and then they can use what they want or feel that they need, and don't have to reinvent anything.
Awesome.
Okay.
Thank you. Okay, partner.
And then Katrina and Arash, if you need anything else, let us know.
Will do.
And thank
Roger
you
that.
for volunteering to do that. Appreciate it. Okay, awesome. Appreciate it. Now, let's move on. Let's get this meeting moving on to the next agenda item, which is agenda item number 7. This is for possible action, discussion, and possible vote on our new applicants to join the ICHHTA committee. We have actually 2 this month that we scored on. I do need a verification from Abigail. Abigail, how many vacancies do we currently have?
We only have one. The committee decided to have 11 seats, and currently we have 10 active members.
Okay. So we have 1 vacancy on our current roster, and we have 2 applicants before us. Both are very qualified individuals that have come forward. We want to thank both individuals for putting forward their application. As we can see, they both scored very high on their applications. So I'm going to open it up for discussion from the group to determine what we do at this point.
This is Brooke for the record. I wanted to just take a moment and disclose I have recused myself from voting on Joanna Grant's application because she is also with the Corporation for Supportive Housing, and I didn't want there to be a conflict of interest with my vote on hers as to why you see it blank. And Joanna has come to the corporation as the new director over Nevada, and so part of her applying to this committee is also for future agenda items to consider replacing my seat on this committee, just given capacity needs and the importance of kind of shifting roles and responsibilities at our organization. So I wanted to just disclose that and let you all know that that is something that is most likely coming in the near future.
So if that's the case, Brooke, could we simplify this by more considering misgrant, I believe, and coming to a time where you want to rotate off. I don't know what the committee's thing of like, if you need to rotate off, can you suggest someone to replace you until next eligible time or what? But I think that if that's really the case, then we could consider Joanna from that perspective. I don't know how the committee operates like that in terms of what happens with an existing member, because we're not necessarily representing us like a stake in something per se, other than just being a member.
Thank you, Arash. I appreciate the context. And I think that is, we elect individuals for this committee and not necessarily organizations. And so the nuance of just the fact that our organization is very highly aligned with the work of the council and the advisory group. So I think that was the reason why we've just had some staffing shifts internally. But we definitely consider the person's seat and not necessarily like we don't have alternates that would replace someone. So I think having that discussion, if that's something we would want to consider moving forward, but I know I'm here representing Brooke Page, not necessarily the corporation for supportive housing.
Right. Couple of other things just to put out there is it is the end of the year. We do need to revisit the attendance for members for the last year to ensure that everybody has maintained the attendance, that folks are in good standing to continue forward. Also, we can extend the number of people we have on the committee through vote. The challenge with that is that that also maintains that we have to have a larger number of people for quorum. And there are times when we have a hard time meeting quorum because not everybody, makes our meetings. So I think that, those are all some things that need to be kept in mind when we start looking at the size of our group and all of that. But I want to make sure all information is put forth as decisions and discussion is being had. Any discussion?
This is Adrienne. The only comment I have is that they're both very strong candidates and would love to figure out a way to incorporate all strong candidates into this work group.
Right?
But for the record, I agree with that. And I also feel like we aren't comparing apples to oranges in terms of the scoring, because not everyone scored that I believe can score these. So it feels like we've got some, we don't have parity, I think, between who, outside of my recusal, I'm not sure of other folks that didn't score either candidate and if that's weighing one more heavily than the other in terms of total score.
Yeah, that's definitely, I guess my comment is Katrina and I can think about that as we propose something for this from the number side, because to your point, if two people recuse themselves and just adding up scores alone, that's not fair. But for this situation that we're in with the existing scores, I'm not sure what we can do about that at this time. And I will say I submitted one score and the other one I think just came in late last week and I haven't had a chance to submit. So I apologize. But if I submitted any scores at all, even with Brooks' recusal, it sounds like Miss Grant would still be up ahead.
Wait, are they
Or
both Miss Grant?
They're both Miss Grants.
oh gosh, that you're
I believe
absolutely right.
they're
I
both
just
Grants.
I'm gonna guess on gender. Well, anyway, so is it Vevelin?
Yes, sir.
Vevelin? Hi. Um, it's awkward talking about you guys when one of you is in here, but
I was
or maybe both
absolutely
of you.
wondering if I should be here right now. I'm sorry. I didn't know if I should
Actually,
excuse
they're
myself.
both here, so you know.
Yeah, well, hi, Joanna, too. Um, well, I guess Brooks' point's a fair point that we need to figure out how to handle the scoring in light of Brooks' recusal, even if I put in my score for the second candidate.
This is Chris for the record, but we're also missing Dr. Pamela Janelle's scoring as well for equivalent.
And
Correct.
Austin and Julie.
So on that note, it sounds like when Arash and I meet to do a lot of the sub group work, we probably need to talk about what happens when we don't have scores for everyone. So I just want to throw that in there. We'll add that to our conversations. So are we like saying yes or no? Can we vote people in without all the scores? Like, what is the rule around that? Without input from all of the committee members, like how does that work in this context?
Arash?
Well, I'm not agreeing to answer that question, but my but kind of a relevant proposal, and people may not like this, but it sounds like the group has tasked Katrina and I to come up with some ideas for this. It also sounds like we only have one more seat and aren't in a dire race to fill it, unless I'm mistaken. If that is the case, my proposal would be, can we suggest a new scoring matrix in a January meeting, have that discussed and improved, and then we rescore these candidates based off of that? And I'm sorry, since they're on the phone, but if we're proposing scoring it and they're both pretty close scoring, et cetera. So I think that the group, in order to be as fair as possible for these two candidates and moving forward to be more consistent, if we can just pause the nominations for a second until we can regroup in January about how we want to do the scoring, resolve that, and then make these the first two that we score, maybe that would simplify the process, because it seems like some of the questions that are answered here are things that Katrina and I also need to figure out moving forward.
Adrian?
This is Adrian. Alternatively, we could put on next month's agenda a conversation to discuss the size of this committee.
Right.
Because we sort of arbitrarily just decided 11 a few meetings ago, but I don't see why we couldn't expand that to 13 if we have, really strong candidates. Just putting that out there.
I'm open to whatever you all want to do. We can put that on the agenda if you'd like to put that on the agenda for discussion. We can also table this agenda item till next month if that's what you all would like to do.
Brooke, for the record, first I want to thank the candidates for taking the time to apply and sitting through this. And I agree it would be helpful for us to get clear about our criteria and ranking, but would they then need to reapply if there's new standards and criteria in order to make sure that they're putting their best application forward for a different scoring rubric? If that's what we decide to do.
Dr. Turner?
Yes, Diana Turner for the record. So to both of their points, Arash and to Brooke's point, I think I'll start with Brooke's point that I agree, or just a comment on, I don't know if we should have them go back and fall under the new scoring criteria, as that's something that we didn't have in place at the time they submitted or participated. So if we go off of the current scoring, what was in place at that time, I think that's fair, to go ahead and keep the current scoring. However, I think that it would also be, maybe this was to, not Arash's point, I'm sorry, to Adrian's point about increasing the number of members as well. And maybe that's something that we may hold off on adding them on until we get that established, that we're going to add more. And I think, and I'm probably adding confusion, so just hear me out, is that keeping with fairness, that they applied under the current rules or the current criteria, right? That we don't want to have them go back at this point, because we don't have it established, that they have to then go back and fall under that criteria to possibly participate. But I think that we should, with Dr. Katrina and Araj getting those portions that we discussed in order, and then possibly also considering the increase of the additional members, that we hold off on actually adding them until that's established or until all of that's complete. But I don't know if we should have them go back and rescore or however, resubmit under the new criteria. But that probably caused confusion or is confusing. So please let me know if there's a question. I'm thinking you guys are confused. So I will, I think I'm confusing myself. Sorry. I'm just trying to think of a way that they've already done this process. They've already submitted. Is that, should we then now retract to place them under a new criteria that we don't have established just yet? So
Yeah, that makes sense.
That's one of the biggest things. I guess all others, I'll retract back and
maybe we need to just have the rest of our members score. Everybody.
Yes.
Under the existing criteria, and then we have a full scorecard for both.
Brooke, for the record, I agree with that. If we send this back, ask members between now and the next meeting, fully score the applicants, and then have the discussion topic about the size of the committee as well. And then for 2026 and beyond, kind of evaluate the working group's criteria for future applicants. Thank you for the clarification, Dr. Turner.
And we can do an adjustment for the recusal, Brooke, because mathematically we can make that adjustment for having to recusing and having, not having your scores in there. So we can do that adjustment, and so that it doesn't negatively hurt Joanna.
Thank you.
How do folks feel about that? Did everybody follow that?
Yes, I did. Brooke, for the record.
Okay, and I'm seeing some thumbs up. So, okay. So applications are going to go out. Y'all are going to get pestered from the H2H team. If you didn't score these applications, you're going to get them again. You're going to need to score them on the current criteria, because we need your score so we can determine who we're going to put forward. It's going to be on next month's agenda. You can quit sharing the screen now, Greg. We also are going to add to next month's agenda to have a discussion about the size of the committee for 2023 going forward, as well as what we've already talked about with Arash and Katrina talking to us about, new scoring criteria for 2026 moving forward. And we will do a mathematical adjustment to correct for Brooke's recusal for the scoring for Joanna. Okay. Now, with all of that, Dr. Turner.
Yes, really quick, Diana Turner for the record. I do have to hop off the call for another meeting. So I just want to make sure that was on the record that I'll be leaving out. Sorry about that.
Okay, thank you.
Thank you. Thank you.
And I don't think with all of that, we needed a vote. Is that correct? Somebody check me on that. We're good with everything we just did without a vote, right? Since I'm not hearing anything to the negative, I'm going to say we're good. I'm going to close this agenda item and we're going to move on. Item number 8, which is the introduction of new and continuing members of the ICHTA committee. Since we don't have any new members, we're going to go ahead and skip this agenda item and carry it to our next agenda, unless I hear any opposition to that proposal. Hearing no opposition, we're going to go ahead and close this agenda item. And going on to agenda item 9 for possible action, discussion and possible vote regarding the current strategic plan and any revisions that need to be made. This is really a follow-up on the outcomes and directions from ICHH. We talked about this just briefly in an earlier agenda item when we were talking about the legislative context. So just as a reminder, we've been asking for months for some direction from the ICHH and really trying to figure out where do we go from here, right? We've developed the strategic plan, we've developed the action plan to go with the strategic plan, and we've been asking, now what? Now, what do you want us to do? And, just trying to figure out what's next. And as I indicated earlier, Chairman Rob did ask if we could, he said that he finally got clarification that the ICHH could put on their agenda to approve the action plan, but they were asking us, because there's so much that's changed and so many moving parts right now at the federal level and at the state level and at the local levels, that he really wants us to take a really good look at the action plan and the strategic plan, just review it, make sure everything is still valid, everything is still accurate, and make sure if we need to make any tweaks, any adjustments, any additions, take anything away, whatever needs to happen to it, take our time to do that. And then as soon as we are good, we feel comfortable with both the plan and the action plan that goes with it, go ahead and vote on it to approve it, and to send it to the ICHH for their approval and for their adoption and approval. And then they will put it on their agenda for adoption and approval. So I asked him for that in writing, haven't received it in writing yet, but I did have that conversation with him last week. So I'm sharing that with you today. So that's where we're at.
Thank you, Michelle. Brooke for the record. So this item needing to sort of assess, and with that direction of wanting to review the strategic plan and any revisions that need to be made. I went back and pulled up the strategic plan. And the last time it appears that there was any updates was from 2021 to 2022. And there haven't been anything substantially like added officially on the record since 2022 for the actual strategic plan. And typically these plans are typically 5-year plans that, you know, kind of go for an extent. It looks like from 2022 or 2021 when the last time it was updated. So 5 years from that would be 2027 that we would be in this window. Given the state of affairs related to the federal landscape and, you know, priorities shifting around priorities around addressing homelessness, I do think it would be important to update the strategic plan to reflect the priorities of Nevada and the things that demonstrate the work that has happened, you know, since 2022 in order to sort of inform and understand what the governor's vision and values, what an updated strategic plan would look like at this particular state of affairs. And I had the privilege of participating at the regional task force on homelessness held a harnessing data and supporting the field with their continuum of care in San Diego last week. And California provided an overview of their Interagency Council on Homelessness strategic plan. I sat in on that session, and it was really apparent to me that the approach that they're taking from the interagency's perspective is really a state approach of how California is addressing homelessness and ending homelessness, and identifying what all from, you know, their Health and Human Services Department to their Department of Housing, their Department of Corrections, like assessing each one of their state agencies and rolling up those priorities into one strategic plan that sort of identifies the ownership that all of the state agencies are playing to address the needs of homelessness in the state of California. California also has a lot of different fund sources that support those efforts, but having it in one document, you know, centralizing that this is a priority and like understanding the processes that each of the departments are taking and using the leverage of the governor's office to hold those state agencies accountable to ensuring that those priorities are met, that whatever values are centered as the state, you know, views those, you know, that getting that charge from the governor's office, I think provides the priority, the teeth, the accountability to ensure that the plan actually is executed and folks are held accountable to moving those priorities forward. So I say that to say, you know, Nevada has actually led the country in a lot of ways of codifying certain priorities around homelessness at the state level and legislature, putting this council, the Interagency Council, codifying that in statute, where this, you know, the Interagency Council has to meet regardless of whatever governor is in office. Like those things are really important from a state perspective. And I think putting that in a strategic plan, having action plans that show, you know, where the state is in these priorities, to me would be a beneficial approach to the work. I feel like the onus has been on the continuum of care, direct service providers, the community, and the onus has been a lot largely on this committee to develop the strategic plan and the action plan without having a lot of necessarily direction from the state or involvement from state agencies in those processes, unless there's a member of the state that's been on the committee. So I don't know, I think taking a different approach and allowing this to be a, you know, more state driven process might bode well with just some accountability and an understanding of like what's happening across the state related to how the state's addressing homelessness. So I'll just pause there to see if that makes sense and if there's any thoughts about, you know, how we approach the strategic plan process.
Thank you, Brooke. So, thoughts? I really, Michelle Fuller Hollauer for the record. I really, sitting here listening to you, had the, you know, it was kind of the aha. It was like the, I want to sit here and do the give smack, you know, to myself of why didn't we think of that? You know, duh. You know, we need, of course, we need the state agencies, you know, to the table. We need to, you know, have the think about what the state's doing and how we're bringing, you know, the state of the state, right? And how they are contributing to the efforts, and the divisions within the state are contributing to the work that is happening, and where that intersection is. So I think what we need to do is figure out how we engage those folks in that conversation and get that information into our strategic plan and the accompanying action plan.
Thank you, Michelle. I agree. I think that requires figuring out the engagement strategy, like having the presentation that we had on the onset of the meeting today from the public and behavioral health. Like, to me, that is an excellent example of what the state is doing to address food insecurity and wanting to kind of bring that to this table when it should be ideally a pillar and a strategic plan, that is a working group that is addressing the intersection of families that may or may not experience homelessness, but to, you know, roll that into one centralized location and the work of that, to me, would be an important exercise for this strategic plan and action plan.
Yeah, I was just going to say that, you know, I wonder if that is, we actually formally ask different divisions, different departments within the state to come and give presentations to this committee. And we have maybe a set criteria of things that we ask them to present to us. And then we take that information and turn that into action, right? Into things that we put into the plan of, this is what they're doing, this is what we need from them, or what this is what they're doing, and this is what needs to happen, or whatever we, you know, determine. Almost like a reverse focus group.
Any other thoughts about that approach? Does that make sense in terms of, I just feel like right now states are playing an important role. Local jurisdictions and cities are playing important roles in preserving their values related to how they address homelessness. Given if federal funding goes away tomorrow, the state, local jurisdictions are still charged with addressing keeping their community safe, housing people, addressing the needs, right? So I think having something that reflects those values and what it is that the priorities of the state are, regardless of what funding source comes and goes, I think codifying that in a plan is really important.
I just want to comment that conceptually, I very much agree with what Brooke is saying. And as a newer member, just trying to understand the scope and relationship between the intent of the group and the strategic plan, et cetera. But I principally definitely agree that we can't, as a committee, help advise a strategic plan that does not actually have some meat in it in terms of what the stakeholders are going to bring to a table or what they can, because otherwise, and I'll give you an example from the youth homelessness sector. We have a statewide needs assessment that we just got done. And the needs assessment says there's a lack of beds, there's a lack of this, there's a lack of statewide funding, there's a lack of XYZ. So that's great. And then what we're going to be doing with some of the funding support from federal and local is working on a strategic plan that says the state needs an office, the state needs X, the state needs Y, then the private sector needs X, Y, Z. The service providers need X, Y, Z, and in these amounts and in these. So I think it would behoove us to think about, if it's strategy, what and how is the state of homelessness in Nevada managed? And helping answer that question, I think, is one of the most important things in the strat plan. If I'm reading you correctly, Brooke, I could have entirely went off on my own tangent and be wrong.
No, absolutely not. Arash, I think that's what I feel like when I think about the intent of why the Interagency Council on Homelessness to Housing was created.
Right.
Is to that point. Like we have so many subpopulations that need a centralized place where these reports and information can be housed in order to have the governor's vision or what are priorities, right, to help ensure that these things get done. And I think that's why the makeup of the Interagency Council is so diverse from state agencies, is to have the authority at those tables to then ensure that those things get done. But it's not necessarily being leveraged in that way, or I think a lack of this state focused approach. And if we don't have the state agency that's governing youth homelessness, like you're saying, then having that recommendation and a plan that is now at a table with state agency representation, I think at least provides some accountability that this is a need and we need somebody to help us figure out how to make this happen.
This is Chris for the record. In listening to your conversation, it makes me wonder how Richard Whitley, our DHS leader, what he would suggest we bring to the table as far as who he would want to be part of this committee in creating a solution for our state. And I think that's what we need to ask is who of your people can we bring in to help us create this vision for the future and the strategic plan to solve this problem statewide? Because I think that either him or Cody Finney, Shannon Bennett, somebody at those levels, they would know the staff best to suit the purpose that we're looking for. And if we give them the opportunity to assign people that they would like to see represented on our committee, I think would be extremely helpful and give us the inside scoop on what they're doing and where their focus is in solving this problem, because that they're working on it. It's a health issue. That's all I got.
Thanks, Chris. Very important.
Other thoughts or comments? I think to Chris's point, even if they're not on the committee, if we have them come in to talk to the committee, right, about what they're doing, or they can identify who needs to come in, right, to Chris's point, who needs to come in to talk to us about who's doing what. I think they're definitely the point people for us. So, other thoughts, ideas, suggestions? What are you next steps? What's the next step for us to put on our agenda to move forward?
This is Chris for the record. Prior to hearing Brooke, I thought I was really feeling confident about making a motion to take it to the Interagency Council, but now I'm a little hesitant that may be a little bit premature. I think Brooke, what you gleaned from California and their approach is extremely valuable, and I think that uh, we should revisit our plan based on that new set of eyes or the new lens that you've given us. You know, I mean, it's been a while since I've looked at the plan, but I think that from what I remember, we did not include uh, agencies other than mentions of the continuum of cares and the HUD portion of the housing issue in our state, but I could be mistaken.
Yeah, thank you, Chris. I really appreciate that. And I agree. I think we did a great job as a committee identifying challenges and strategic issues that we know are really important. It's a matter, I think, of understanding what is the state doing around homelessness? How do we get that into this plan so it's represented? So, you know, and it's not just the onus is not just solely on the continuum of care or one particular location to address this when we have the state agencies that are also doing things that could help inform the goals that we've identified. Maybe there's issues that we've thought about and don't even realize that there's a state agency that's governing those topics that we could technically, you know, categorize some of these strategies with. So I don't know if this requires us to um, make a recommendation or like do a memo to the Interagency Council with the idea of wanting to get more feedback into the action plan, an updated action plan, a strategic plan related to what the state agencies are doing to address homelessness and codifying that. But I think we would need maybe just to kind of have a discussion about an update and the need for an update and wanting the update to be more representative of the state's actions to address homelessness.
Abigail, when is the ICHH planning to meet again? Do you know?
They have not, most of them have not responded to the proposal yet, but if they do, it will be on February 19th.
February 19th. Okay. I wonder, to your point, Brooke, and to your feedback, Chris, if it makes sense for us to ask if to be on the next agenda in February and kind of to your, doing the memo, we can write a memo, but also to tell them that this is what we would like to do, that we would like to start having presentations from the state agencies. These are maybe even present them with a list of the preliminary state agencies that we would like to have presentations from or information from. Maybe present them with, information and the type of information we want, whether it be presentations or just information we want them to send to us. And maybe we do that. And maybe that's what we talk about, put an agenda item on the next meeting and talk about what we want from them and how we present it to them. Maybe it's not a presentation. Maybe it's literally we send to them a request for information and say, we would like this from each department that you all represent, and we'd like you to send it to us by such and such a date. I mean, I don't know what that looks like, but
Yeah.
I agree. We probably need information. It's just how are we going to get that in what format and in the most expedient manner to get what we need.
Mhm.
Because we don't want to wait 2 more years to get what we need.
Thank you, Michelle. Brooke, for the record, I agree. Maybe us taking some time to identify what information would we want. Can we have the authority, or like what authority would we need to sort of ask, and who do we ask to get the information that we need? And how do we get it in a format that's going to be the easiest for us to compile to put into an updated strategic plan, so we aren't having to make a huge lift and it's just a matter of updating it with some key information.
Yeah.
But the goal, I think, would be for us to understand what are each department doing, maybe for a certain target population, certain issues, and do they have priorities or plans related to what they're doing? Is there funding to support what they're doing? And just to kind of get an understanding of that.
Yeah. So do we need a ad hoc small group to work on this, or do we think this is something that we can knock out at our next meeting?
Any questions or thoughts? Adrienne, I'm curious your thoughts about this question. I mean to put you on the spot, but do you have any concerns?
Not concerns, only, I guess, I don't want to use the word frustration, but I feel like this strategic plan should be a work in progress. Like it should be a living document. And I guess I'm just sort of dumbfounded that it hasn't been updated since 2021, you said, because I thought all of the work that we were doing on the action steps for the strategic plan was what we were presenting to be adopted by the committee. I did not realize that the actual strategic plan document had never been officially adopted.
It was.
It was.
Yeah, it
Okay.
was.
So I absolutely agree that there needs to be collaboration at the state level. I think that's a great idea. I'm hesitant to put off any action that we can get the ICHH committee to take timely. If we, if they want to adopt our strategic plan and then we come back with proposed amendments or updates, I want to make sure that we're keeping any momentum that we have going on this. I don't know that I answered your question, but I would love to find joy in this meeting and feel like, you know, we are making real action and change. And I'm just struggling right now, I think, at this point.
Yeah,
So,
thank you.
Adrian, do you have thoughts about whether we should have a small ad hoc committee kind of tackle the kind of the questions around what do we want from state agencies? How do we get it? What format do we need it in? You know, those kinds of things between now and like the next meeting, or do we think we can just tackle that in the next meeting?
You know, in my opinion, I would love to say that we could just tackle it in the next meeting, but I just don't think that's true. So I think ad hoc meeting with a dedicated agenda, dedicated deliverable, is where I think we need to put our focus.
Yeah, agreed. And I don't think we throw the baby out with the bathwater. Like, we have some really important work that we build upon. This isn't starting from scratch. I think this is layering in, I think, a missing link to what feels like we're not able to enforce, because it's like we're taking a bottom up approach of like the community saying we need these important components in an action plan, but there's not necessarily a connection to what is happening at the state level that we can point to. So I don't know. I just feel like it's us building upon the work that we've already done.
Yeah. Okay. So what do other folks think? Anybody have any opposition to having an ad hoc group? Anybody want to volunteer to be part of that ad hoc group?
I'll be part of that ad hoc group. And I just glanced through our November revisions that was sent out and where we are, just to remind myself. And I think that we're really close. And I like to agree with, I think it was Adriana that said that that was feeling frustrated. But I think that we're close. What we're missing is the part that the state agencies are working on that's consistent with our strategic plan. Because most of the things that we have mentioned in there, we know agencies are working on. We just haven't captured that information yet to add it to the plan. So I do think that we have a good plan. And I think that we're extremely close. I'd like to know, I, I'd like to add that one last part of what the state agencies are doing, consistent with this plan, to where what we're providing to the Interagency Council is a whole picture of what's going on in our state.
Thank you, Chris. Anybody else want to be on that ad hoc committee?
I'll like to join the committee.
Okay. We can have one more person.
This is Adrian. I can do it and help Liz on behalf of the state.
Okay. Awesome. Is there anything that you all would know that you're going to need from us or the H2H team?
This is Adrian. I guess I would invite any open comments or recommendations on what folks think as we discuss in the group. Katrina, I see you have your hand up. I'll go back on mute. Sorry, I didn't raise my hand.
Katrina, for the record, I'm not volunteering to be part of the ad hoc group, but can you guys add me so I can see when you're meeting, so I can see if I'm available? But I'm not like 100% committing right now, if that makes sense.
Well, we have to be careful so we don't meet quorum. Because this is a state meeting, we have to be
Okay.
very, very cautious not to meet quorum.
Oh, okay.
Otherwise, we are in violation of open meeting law. So we can't have more than 3 people in in an ad hoc committee.
Makes sense. All right. Well, disregard. Thank you.
But thank you for volunteering. I do appreciate that. Okay. So Adrian, you were saying some things that you were thinking that you might need.
Yeah, so I mean, I guess if anybody has thoughts on what the ad hoc group should consider, departments that we should consider outreaching, or materials that you'd like to see, you know, just because you didn't volunteer to be a part of the committee doesn't mean that you're not allowed to have thoughts to be considered. So if we could invite those comments for review in the ad hoc committee meeting.
Okay. Appreciate that. Any other thoughts or ideas on this agenda item? If you could let us know when, or let Abigail know when you guys are meeting, to let us know when you need our thoughts, materials and things for consideration, so we can make sure that we get them to Abigail to get to you all. That would be good, I think, so that we do to make sure that we get things to you so you can consider them.
Great, thank you.
Sorry, excuse me. Okay, if we have nothing else on this agenda item, I will go ahead and close it. And move on to agenda item number 10. For information only, do we have any, this is discussion for agenda items for our next meeting. We have actually brought up a lot, so I want to make sure we've captured everything is already brought up, and if you have anything new that has not brought up. So I think what we've got is we are going to have a report back on the findings from the scoring ad hoc committee that Katrina and Arash are manning, that they will finalize definitions, criteria, and potentially revisit the letter that goes out as we are doing recruitment. Another agenda item will be to discuss the size of the committee. We will have an agenda item on the vote around the new applicants. We'll review the vote for the new applicants because that going to go back out to everybody who didn't submit votes for them to submit their votes. So we're going to review the voting so that we can vote, or the scoring, so that we can vote in the new applicants for the ICHH committee. And then we will do the introduction of new and continuing members of the ICHHTA committee. And then we will have a, I would say probably Discussion and possible vote regarding the current strategic plan and revisions that need to be made, kind of that same verbiage that we've had on the agenda for a while, that blanket language that allows us to do any necessary revisions, and that would allow that strategic plan expansion ad hoc committee that we just created to do your report back, and for us to do any voting and discussion and voting on that. Did I capture everything we've talked about? Have I missed anything? Is there anything else you want on the agenda?
That sounds accurate to me. Thank you.
I mean, I actually captured it all?
From what I heard.
Uh-huh. Thanks, Brooke. Now I feel better. All right. Anything else that we want on the agenda for next month? Nothing? Okay. Going once? Going twice? Gone. Okay. We're going to close this agenda item and we will move on to the last public comment for this agenda. No action may be taken upon a matter that raised under this item of this agenda until the matter itself has been specifically included on an agenda as an item which action may be taken. Comments will be limited to 3 minutes. If you're making a public comment via phone, please call 1-775-321-6111. The ID number is 489-058-294#. Please unmute yourself and introduce yourself for the council. Any public comment? I have one very quickly. I know that we are preparing for a couple of holidays, but do keep in mind that the annual unsheltered point in time count is coming up in January, the end of January, for all 3 COCs. So that's across the whole state, including the rural Nevada COCs. Rurals are going to be doing things a little bit more robustly this year. So no matter where you live, no matter where you work, we can use you, and we can use your friends and your colleagues to help count the folks that are experiencing homelessness in your communities. So reach out to your local continuum of care, folks that are in your community for your local continuum of care, and see how you can help. Get involved with the point in time count. And if you're not sure who to contact, let me know, or reach out to the Homeless to Home team, and they will help you figure it out. More than likely, they'll reach out to me and say who to contact. But either way, we'll help you all figure it out on who to contact to get involved in the annual point in time count. Throughout the whole state, it will be January 29th that we are doing the count. So think about that, put that on your calendar, talk to your friends and family when you get together with them for the holidays. So we know that y'all are getting together. So start talking about that, because we all need your help. We need to count the folks that are experiencing homelessness so we know what kind of resources we need to get them off the streets, to get them into services, to get them on their way to stability. So there's the pitch. Thank you. Anything else? Any other public comment?
Yes, I would like to make one. This is Arash Ghafouri, and I would just like to wish everyone happy holidays and thank you for everything you all do in your domains to be game changers.
Thank you, Arash. I concur with that sentiment. Okay. Any other public comment? Seeing none? Hearing none? It is 3:20 p.m. With that, and with these words, I wish everyone a safe and happy holiday season. We will see you January 20th, same time, same bat channel. And I wish you all happy holidays. Be safe. And with that, our meeting is adjourned.
Thank you. Happy holidays.
Thank you all.
Happy holidays, everybody.
everyone.
Yeah, happy holidays.
Katrina,